Welcome to Adapted Place. Let's continue with our series, number 7, commonly tested topics. I know some of them, you know them, but if they ask you a question in that form, how do you answer it? And we're going to work on test-taking strategy. First question, as usual, read it from the back, figure out what is going on. What is the most, underlying most of appropriate evaluation the nurse should anticipate? I have a 56 years old, male, BMI of 38, present to the outpatient clinic with complaint of daytime sleepiness. It's affecting his job. Morning headaches, right? 2 traffic tickets for causing a jam at the traffic light, probably sleeping. Wife is reporting what? Excessive snoring. You feel tired after 9 hours of sleep, not a good one. He has concentration problem. What do you think? This is a full case. They will give you 6-question case that are shortened into standalone. But this is the stem of the question. This is what it's going to be. If the board is going to ask you, it's going to give you this information. This patient is meeting some of the criteria of what? Stop bank, right? In 56 is age, meeting greater than 55, is male, gender, sex, right? Is BMI 38, right? That's his BMI, right? Is greater than 35 is the criteria. He presents to the RC clinic with sleeping problem. He has sleeping issue, which is affecting his job. He has morning headaches. These are what? Signs and symptoms. He has had 2 traffic ticket because he's causing traffic at the traffic light. Why? Because he's sleeping. His wife is reporting about snoring, right? He's tired despite 9 hours of sleep, right? Concentration problem. As the wife probably observed apnea. I did not give you his blood pressure, but he has met some of the criteria for stop bank. If they give you the question, they're not going to give you everything about it. A stop bank is sleeping, snoring problem, being tired. Somebody is observing you for snoring, right? Your blood pressure is going to be high. You have a BMI greater than 35. You have age greater than 55. And you have neck size greater than 17 inches, and gender is male. It doesn't mean you have to meet all these criteria. At least 50% of them is enough. If the board give you this is what they're going to give you. And how do you answer case studies? Put all of them together. When you put all of them together, they make sense. This patient has a sleep apnea. What will you do? There's nothing in the case telling you need a stress test, right? I know we may need to lose weight, but this is not the totality of the case. Polysomnography is the same thing as sleep study. They're not going to give you a sleep study. They will try to confuse you and give you this polysomnography. You've never seen it, but that is the same thing as sleep study. CPAP, you have to diagnose the individual with the sleep study before you give them CPAP. Don't get trapped. Put number 3, sleep study first before CPAP. Sleep study test first before CPAP. Number 2, what do you think? Same thing. Which of the following medication the nurse should question during the medication reconciliation? I have underlined 2 buzzwords. I'm focused on it, laser focus. The client presents to the outpatient clinic for routine evaluation. The client is on what? Valerian route for insomnia and migraine. Which one is your question? You should know this. Some of these herbal medication, I have a video free on YouTube. You can watch it. All the medications you need to know. Valerian root can be used for insomnia and migraine. It can also be used for menstrual cramp. Okay? Therefore, if you take it, anything that depresses your, is a downer, is always a problem. You can't take it. Insomnia, you take it, people take it for insomnia so that they can sleep. So you make it sleep. Therefore, if you take something that will put you to sleep, downer, yeah, it's not good. I know clozapine sometimes will give you some drowsiness, but that's not the major problem. The major clozapine is antipsychotic, and haloperidol is also antipsychotic. They're all wrong. The number 1, okay, that you should question is Diazepam. Okay, these medication potentiate. We make Valerian roots make Diazepam worse. Therefore, that's number 1 that you should worry about. I know somebody say, oh, SSRI, no, they make you gain weight. They don't even make you sleep, right? Insomnia, that's the biggest side effect. So you can't give it somebody who has insomnia with fluoxetine. It may give you a little bit of drowsiness, but that's not its major problem. Insomnia is the biggest one. Like when you take Valerian root, don't take Diazepam because it will potentiate the effect of that. So that's number 3 is your right answer. Number 3, select or apply. Which of the following teaching the nature include? I know it's a teaching, it's a select or apply. I have 6 questions. I can pick 1, 2, 3, 4, 5, 6. I pick the answer choice. I'm confident 100%. I don't pick those I'm guessing. So if you're guessing, don't pick it. A 7-month-old, right? As a Phenylketonuria is being evaluated at a pediatric clinic for routine evaluation. Which of the following teaching the nation include? You have to know this, PKU. This is one of the newborn tests we do. We do it 2 or 3 days later. You don't have to do it after 24 hours, but 2 days is better, 3 days. The kid has been diagnosed with phenylketonuria. What is the problem? They have a problem with phenylketonuria metabolism. This is a protein. They can't digest it. This protein is converted into tyrosine. So if you can break this, your tyrosine level is going to go down and your phenylalanine level goes up. What you need to do, decrease the amount of phenylalanine in your diet and replace tyrosine in your diet. You cannot stop phenylalanine forever. It's in every protein. It's a protein that we need, but you got to decrease the amount, right? So avoid protein-rich food. Yeah, food that has too much protein in it will have too much phenylalanine. So this is good. Tyrosine replacement in diet, right? Your tyrosine level is going to go down, so you should give them that. No phenylalanine in diet. The word no make it think is wrong. I mean, you shouldn't, there's no way you can eliminate phenylalanine completely in your diet. You got to, the answer choice should say low phenylalanine diet, okay? You can't, like gout, you cannot completely remove protein from your diet when you have gout, but you got to decrease amount of protein that will cause gout, a gout-prone diet that has too much protein in it. So this is a wrong teaching. Increase intake of natural food. Yes, fruit and vegetables has less fruit protein. Order specialized baby formula. The kid will need a specialized baby formula that has a very low phenylalanine. Lifetime diet modification or recommendation. This is the rest of his decade life. They cannot change. This is not 6 months problem. It's for life. So when you have a PKU, you're going to be on low phenylalanine diet the rest of your life. So these are the right answers as selected. Okay. This is content you have to master. Number 4, same strategy, select or apply. Which of the following is indicated? 87-year-old. It's a reason why I give you older patient. Why did I put nursing home resident? It's very important. When you're taking the test, look for password. When they put something there, it's not for fun. Why do I say it's 87-year-old nursing home? Why don't I say somebody who's a post office worker or work in a hospital? 87-year-old nursing home resident is my password. If you figure out that is the password, which one? It came in with what? Acute, sudden, okay? Disorientation, confusion, and restlessness. What do you think is going on? Put it together, password. This can be a full case. 87-year-old is in a nursing home, right? All of a sudden, he's confused, he's restless. Think about delirium. Every time they give you this case, acute onset of change in mental status is delirium until proven otherwise. Then you ask yourself, what are the things who cause this delirium? Right? Low sugar. So therefore, check your finger stick. Infection, UTI. Oxygen saturation, hypoxia. Get a chest rate, make sure they don't have pneumonia. Electrolyte problem will cause delirium. So all of them are right answer. Select and apply. Now, Then I repeat the question and I change it a little bit. Don't memorize the questions, okay? 85-year-old nursing home resident is in the emergency room due to acute onset of what? The same thing. Disorientation, confusion, and restlessness. Which of the following is the best test to order? The normal one problem that will cause confusion, delirium, in the patient who is old, 87-year-old, and is in the nursing home, is infection. What kind of infection? It's mostly UTI. It's normal one. So the best answer is urinary analysis. Somebody will argue, but please don't argue about this. There's a bunch of infection. It can be pneumonia, others. Look, the normal one cause of confusion, disorientation, and then restlessness, which is all signs of delirium in a nursing home. Older client is UTI. Number 2 is your best answer. The nurse is reviewing fluid with new graduate. Which of the following the nurse should include as hypertonic fluid? So which one is hypertonic? Which one should you include as hypertonic fluid? Hypertonic fluid should have a percentage greater than 1%. Okay, it should have sodium concentration greater than 1%. That's all. Or greater than 0.9%. Which one? I see 3%. I'm picking. LR has the same concentration as sodium, 0.29 or 1%. Therefore, I'm not picking it. 5%, excellent. Mannitol is an hypertonic solution. That's why we use it for what? Somebody with the ICP. So this one is the right answer. D5W in the bottle is an hypertonic solution. But when you infuse it, your liver breaks it down and it becomes hypotonic. So D5W in the bottle is also hypertonic. Therefore, what are your right answers? 3%, 5%, mannitol, and D5W. Okay, next question. 87. A nurse is reviewing metabolic syndrome criteria for a client, a female client. There's a buzzword. Why I put female there is a reason why. With the new graduate, which of the following the nurse should include? You have to know metabolic syndrome criteria. It's made up of what? Waist circumference, made up of triglyceride. It does not have cholesterol. It's made up of your blood pressure, hypertension. It's made up of your glucose. It's made up of your HDL. There's no triglyceride. There's no cholesterol in metabolic. So this is completely wrong. If it's a female, there's certain criteria. If you're greater than 35 inches or equal to, yeah. If your triglyceride should be what? Not 200, it should be 150. Okay, so that's the criteria. Even though this said 200, this is too high. The minimum you need is 150. The cholesterol is not included. Your systolic blood pressure should be greater than 130. Good. Your HDL should be less than 50. That's good. So the criteria is waist circumference greater than 35, triglyceride greater than or equal to 150, systolic blood pressure greater than 130. Okay, diastolic is like 80 to 85, and then HDL less than 50. Your glucose should be greater than 100 or equal to. All of them, if you're taking medication for triglyceride, your blood pressure, your cholesterol is still included. So the right answer for this patient is a female. Is this one? This is wrong. This is wrong. This is wrong. This is wrong. 3. And your right answers. The next one. So this is the same question. I'm just changing the criteria. The difference is a male. The waist circumference should be 40. Triglyceride, 150, excellent. Glucose greater than 100. Your systolic blood pressure greater than or equal to 130. And HDL should be less than 40, no less than 50. So 1, 2, 3, 4 are your right answers. Okay, so you got to know the criteria. Check adapted class for details. Next question. A nurse is preparing to admit a client who need airborne precaution. Which of the following the nurse should include in the plan of care? You got to master infections control. Airborne precaution, when you need, the nurse wear fitted respiratory mask. That's N95. Good. Client in semi-private negative pressure room. So this is controversial. But I want to, when they say it like that, I will not pick it. Negative pressure room is good. Semi-private room, it means you can only put them in the semi-private room if they are cohorting, if they are in the same room with another patient. Anybody who need an airborne precaution should be a private room, but you can put them in the semi-private room if they are cohorting. I don't see the word cohorting in that sentence. You can argue it, but I'm not picking it if I'm taking the test. A semi-private negative pressure room means I'm rooming with somebody else. It should be a private negative room, private negative pressure room. Unless they say semi-private room, cohorting with another patient, yeah. So I'm not picking this. Client's main door closed at all time, yes. You don't need a single-use equipment, okay? This is, I know you say, oh, yeah, but if you have a measles and all those things. No, for your test, airborne is about masks and room only. So single-use is mostly for contact precaution. Yeah, there's some disease process that need airborne and contact. Like if I give you varicella, yeah, I never say it's varicella, okay? Varicella is airborne and contact. And if I say varicella, for the airborne, it's about masks and masks and masks in the room. Client wear N95 when outside the room. No, they wear a surgical mask. So this is wrong, this is wrong, this is right, this is wrong. So the right answers, once again, let's review. Nurse wear N95. This is wrong because of this. There is no cohorting stated. Mail door is closed at all time. I don't need a single-use equipment. Client does not wear this. You wear only surgical mask when it's outside. So be consistent. Don't over-select. Know the concept and stick with it. Number 10, what do we have? The nurse is preparing to admit the client. Now I give you adenovirus infection. Which of the following the nurse should include in the plan of care? I know adenovirus is what? Droplet and what? This is contact. Therefore, I'm going to institute both droplet and contact precaution. Nurse wear surgical mask is droplet. Client in the semi-private negative room pressure. First of all, there's no negative room. It can be in the semi-private room if it's cohorting. Therefore, no. The client mail door closed all the time. You don't need to droplet. You wear a mask when you are in 3 feet away, right? And then the contact, you don't even wear anything. You go there until you're about to touch them, you wear gown and gloves. So the door does not need to be closed all the time. If I walk outside, I'm not going to get any infection. So this is wrong. Single-use equipment is for the contact. Client wears surgical mask when outside. Yes, wear surgical mask. The nurse wear mask, gown, gloves outside the client's room. Yes, because of the gown and the gloves is for the contact and the mask is for the airborne. So the right answer is 1, 4, 5, and 6. So these are the right answers. 1, single-use equipment, mask outside, the client wear masks outside, and then 5 and 6. So 1, 4, 5, and 6 are your right answers. Next question. A nurse is doing intake assessment for a client diagnosed with diagnosis of what? Primary hyperparathyroidism. When they give you this, pay attention. Make sure it's not thyroid problem. There is hyperparathyroidism. So hyper. That's why I capitalize it, para. This, whenever you see para, think about calcium, high calcium. If calcium is high, phosphorus go down. What are their symptoms is all related with what? Hypercalcemia. And hypercalcemia symptoms are down, or your symptoms should be going down. So that's what I'm going to use. Low calcium, because this is hyperpara, the calcium should be high. Elevated serum phosphorus, if calcium is high, phosphorus should be low. Depression, symptoms going down. Constipation, symptoms going down. Shorten QT interval. Because you have too much calcium, the QT interval will shorten. History of kidney stone, you form kidney stone. Things are going down. So to remember hypercalcemia, yeah, symptoms going down. Remember, calcium and phosphorus are interchangeable in terms of relationship, inverse relation. Okay. And the last one, number 12. And next is teaching new graduate about type 2 diabetes. Which of the following the next should include in the teaching? Type 2 diabetes is common in obesity. People are obese. They have insulin resistance. They have insulin, but it does not work the way it's supposed to. That's why you give them metformin to increase the sensitivity of the insulin. High risk for DKA. No, they don't develop DKA. They develop HHS, hyperosmolar hyperglycemic non-ketoacidosis state. They don't have ketoacidosis, so they have HHS. That just because they are diabetes means they're going to get DKA. They will never get DKA, they get HHS. Oral hypoglycemic drug is the initial. Yes, they usually start taking pills before they inject. It's found in older patients, no kids. So the difference between type 1 and type 2 is what I've stated. Obesity, insulin resistance, no DKA, take oral tablet, and it's on older patient for type 2 diabetes. The opposite is for young kids for type 1. This is the end of it. Test taking strategy, key facts you need to know for your test. Good luck and Happy New Year.